So good morning students. This is Dr. Kranti Rajapalle working as a faculty in Shatavana University. So today I am going to discuss types of syndromes caused by drugs. Here the syndromes are Stevens-Johnson syndrome, Redman syndrome, Race syndrome, Gray-Baby syndrome, hand-foot syndrome and finally Fanconi syndrome. So these are the syndromes caused by drugs. So the first syndrome is Stevens-Johnson syndrome. Stevens-Johnson syndrome caused by sulfonamides. Mainly caused by sulfonamides. Sulfonamides are antimicrobial agents. Examples of sulfonamides are sulfamethoxazole, sulfadiazine, sulfaestamide. So these drugs causes Stevens-Johnson syndrome. Stevens-Johnson syndrome is nothing but hypersensitivity reactions. So hypersensitivity reactions are allergic reactions mainly caused by sulfonamides. Apart from sulfonamides, nevirapine, it is a non-nucleoside reverse transcriptase inhibitor. Generally, this drug is used to treat HIV. So the advantage of nevirapine is it is inhibit the transmission of HIV from mother to baby. This is the advantage of nevirapine, but the disadvantage is nevirapine causes hypersensitivity reactions, that is nothing but Stevens-Johnson syndrome. So nevirapine, apart from nevirapine, so HIV inhibit the prevention of HIV from mother to baby. Another drug also there, that is girovidin. This is very important for the competitive examination. There are only two drugs used to treat HIV transmission from mother to baby. So next, the third drug, that is carbamazepine. Carbamazepine, basically it is an anti-epileptic drug. So carbamazepine also causes Stevens-Johnson syndrome, allergic reactions or hypersensitivity reactions. Next drug is phenytoin. Phenytoin also causes Stevens-Johnson syndrome, hypersensitivity reaction. Phenytoin also comes under anti-epileptic drug. So this is about Stevens-Johnson syndrome. And the next syndrome is Redman syndrome. So Redman syndrome, this syndrome is caused by vancomycin. So vancomycin basically it is an antibiotic. So it has several advantages. Vancomycin is active against the MRSA, that is methicillin-resistant Staphylococcus aureus, is treated with the mainly vancomycin. The problem with the vancomycin is it causes Redman syndrome because this vancomycin acts on mast cells, releases histamine. As we know that histamine is responsible for the hypersensitivity reaction. Histamine binds to the respective receptors like H1 receptors. So after activation of the H1 receptors, it produces hypersensitivity reaction. So it leads to Redman syndrome. So this is the major drawback of vancomycin. So that's why doctors avoid vancomycin. So alternative drug to vancomycin for MRSA is, that is linezolid. So alternative to vancomycin for MRSA, that is linezolid. So linezolid does not cause Redman syndrome. This is the advantage of linezolid. But linezolid also has one disadvantage. The drawback of linezolid is the chronic use or regular usage of this linezolid causes optic neuritis. Optic neuritis or blindness caused by linezolid. So this is about red man syndrome. The red man syndrome caused by vancomycin. Next syndrome is Rey syndrome. Rey syndrome caused by aspirin. Aspirin is non-steroidal anti-inflammatory drug, analgesic, antibiotic. At low doses, it acts as an antiplatelet drug. So aspirin produces Rey syndrome in children. So in children, aspirin produces Rey syndrome. We should not give aspirin to the children, those who are recovering from viral fever. So aspirin, if it is given to the children, produces ammonia. This ammonia enters into the brain and produces encephalitis. This encephalitis is produced by aspirin in the children. So that's why aspirin should not be given to the children under 12 years old. So this is about Rey syndrome. And the next syndrome is Gray baby syndrome. Gray baby syndrome is caused by chloramphenicol. So this chloramphenicol is broad spectrum antibiotic. It works on both gram-positive as well as gram-negative bacteria. It inhibits the protein synthesis of bacteria. But chloramphenicol, when it is given to the infants, so it produces Gray baby syndrome due to the deficiency of glucuronide transferase enzyme. This enzyme is absent in infants. So this enzyme is mainly for the metabolism of chloramphenicol, UDP glucuronide transferase enzyme, which is essential for the metabolism of chloramphenicol. So it is absent in the infants or newborn babies. So chloramphenicol unable to get metabolized in absence of UDP glucuronide transferase enzyme and increase the chloramphenicol concentration in the plasma and produces Gray baby syndrome. So this is the major drawback of chloramphenicol. That's why chloramphenicol should not be given to the infants. So this is about Gray baby syndrome. Next syndrome is hand-foot syndrome. Hand-foot syndrome caused by the drug known as, that is, capecitabine. So it is a prodrug of 5-fluorouracil. So these two are the antimetabolites, pyrimidine antagonists, capecitabine and 5-fluorouracil. So after metabolism, capecitabine turns to 5-fluorouracil. Capecitabine enters into the tumor cells and then it turns to 5-fluorouracil. So these two are the anti-cancer agents. This capecitabine is mainly used to treat colorectal cancers, esophageal cancer, gastric cancers, breast cancers are treated with the capecitabine. So the regular usage of capecitabine produces hand-foot syndrome because the drug is concentrated in the hands and feet. So produces hand-foot syndrome. So the symptoms including edema and erythema and pain. So these are the symptoms of hand-foot syndrome. So the mainly caused by capecitabine. So this is very important. So it is 2021 GPAT question. Hand-foot syndrome caused by which drug? That is nothing but capecitabine. And the next syndrome is Fanconi syndrome. So this Fanconi syndrome is nothing but nephrotoxicity. So this Fanconi syndrome caused by all tetracyclines except doxycycline. So the reason is the tetracycline. Basically, these are broad spectrum antibiotics. Tetracycline inhibit the again protein synthesis similar to that of chloramphenicol. So tetracyclines or tetracyclines when exposed to moisture or heat, okay, any changes in the pH. So the tetracyclines comes to epitetracyclines. Epitetracyclines. These epitetracyclines, okay, tetracycline undergoes epimerization. After epimerization produces epitetracyclines. These epitetracyclines accumulated in the nephrons and damages nephron. So that this damage of nephrons, that is called Fanconi syndrome. So this is about Fanconi syndrome. Fanconi syndrome is caused by all tetracyclines except doxycycline, because doxycycline does not undergo epimerization. So that's why doxycycline is safest drug in renal impaired patients. This is very, very important. So this is about drugs. This is about syndromes caused by drugs. So these are the important syndromes, very, very important for the competitive examinations. Thank you.